Okay, so let's jump right into a fascinating medical mystery. We're going to look at a bunch of different conditions that, honestly, on the surface, seem like they have nothing to do with each other. But you got to stick with me because the hidden connection between them, well, it's opening up a whole new frontier in medicine.
All right, first on our list, treatment-resistant depression. We're talking about a situation where someone has already tried at least 4 different kinds of antidepressants and nothing has worked. It's a really tough spot to be in with very few options left. Next up, something completely different. Rheumatoid arthritis. You've probably heard of it. It's a chronic autoimmune disease, which basically means the body's own defense system gets confused and starts attacking the joints. It leads to a ton of inflammation and pain. And then there's chronic migraine. If you've ever had one, you know it's not just a headache. It's this severe neurological issue that can completely knock you out for days, really messing with your quality of life. We've also got PTSD, or post-traumatic stress disorder. This is a really complex condition that can happen after someone goes through a terrifying event. It can leave their body stuck in this constant state of high alert, of stress. And last but not least, inflammatory bowel disease, or IBD. Think of conditions like Crohn's disease, where you have this persistent, chronic inflammation in the digestive system. So, just to recap, we've got the mind, the joints, the head, and the gut. All over the place, right? Which leads us to the big question of this whole explainer. What on earth could possibly tie all of these incredibly different health problems together? Believe it or not, the answer is a single wandering nerve. That's right. This one nerve is the solution to our mystery. You can think of it as the body's information superhighway. It's this hidden connector that's been linking all these seemingly separate parts of us all along.
So let's get formal for a second. It's called the vagus nerve. It's the 10th of our 12 cranial nerves, and it is by far the longest and most complex of the bunch. It starts way up in the brainstem and literally wanders all the way down into the abdomen, acting like the main communication line between your brain and your major organs.
And when I say it connects to a lot, I mean it. The scale of this network is just wow. The vagus nerve plugs into your voice box, your heart, your lungs, your entire gastrointestinal tract, and even organs that are crucial for your immune system, like the spleen and the liver. It's a massive two-way street for information.
Okay, so this is where it gets really cool. Science has moved way beyond just knowing this nerve exists. We're now actually learning how to tap into it, how to communicate with it, to treat diseases. And we do this through something called vagus nerve stimulation, or VNS. Now, originally, this was a pretty invasive thing. It meant surgery to implant a device. But lately, and this is a huge deal, we've developed non-invasive, handheld devices that can stimulate that same nerve right through the skin. It's a total game changer, with way lower costs and much, much fewer risks. And just so you can appreciate how big a leap this is, take a look at the old surgical method. You're talking about an incision in the chest, another one in the neck, tunneling a wire under your skin, and then carefully wrapping electrodes around this super delicate nerve. It's a serious operation, which really shows you why these new non-invasive options are so revolutionary.
So the big question is, how does zapping this one nerve create such a massive impact on all those different conditions we started with? Well, it all comes down to what that nerve controls. One of the key mechanisms is a pathway with a very sciencey name, the cholinergic anti-inflammatory pathway. But here's what it means in simple terms. When you stimulate the vagus nerve, it sends a signal to your spleen and basically tells it, hey, chill out, stop making so many of these molecules that cause inflammation. This directly explains how VNS helps with things like rheumatoid arthritis and IBD. It's literally telling the body to turn down its own inflammation.
And the results can be pretty dramatic. For instance, in one clinical trial for acute migraine, patients who used a non-invasive VNS device were about 3 times more likely to be completely pain-free after just 30 minutes compared to people who used a fake placebo device. That shows a really direct and fast effect on the brain's pain pathways.
And for PTSD, the effects are just profound. Studies are showing that VNS can seriously reduce symptoms because it directly calms down the body's fight-or-flight response. It actually lowers your heart rate, can improve cognitive stuff like memory and attention, and it boosts the parasympathetic nervous system. That's our body's natural rest and digest mode that helps us calm down.
So, what does all of this mean for the future of medicine? This isn't just about a new gadget for a few diseases. We're really talking about the very beginning of a whole new category of therapy.
Welcome to the era of electroceuticals. Yeah, it's a cool word. Instead of using a chemical drug to change your body's chemistry, electroceuticals use targeted electrical pulses to tap into and adjust the body's own wiring. It's like medicine that speaks the body's native language, which is electricity.
Ultimately, what a technology like this represents is a huge shift in how we think about health. It's moving us away from just treating one symptom with one drug and pushing us toward a much more holistic view, one that sees the body as this complex, interconnected system where the brain, the gut, and the immune system are all constantly talking to each other.
And this brings us all the way back to some wisdom from almost 100 years ago. Dr. Peabody reminded us that our emotional life and our physical health are completely intertwined. You can't separate them. Technologies like VNS that directly bridge our nervous system, our immune response, and our mental state, well, they might just be the first tools we have that truly respect that deep connection. It makes you wonder, what else can we heal by listening to the body's own superhighway?